Welcome back to Healthy Living for Life. Today we're with Cheryl Sobek to explore the benefits of music therapy. Thank you for being with us again, Cheryl. I wanted to follow up with what we were talking about before the break, and can you tell us what a typical music therapy session might be like?
Sure. Music therapy sessions, of course, are based on the needs of particular patients and clients, so they may be different in different settings. There's no real typical session, but I can tell you in my work with children and adolescents, much of my work focuses on helping them to identify feelings that are within them, be able to contact those feelings safely, and then express those feelings safely. A lot of the kids that I work with are suicidal in nature, some are even homicidal. It's important that they learn how to manage those feelings safely so that they can move forward with their lives. And music therapy is used in so many other settings as well. For children even, it's used in hospitals to help them prepare for surgery. It can help them alleviate pain in burn centers. It's used with adults in many settings, whether it's in a medical hospital, an oncology unit, in birthing rooms. It's used with the developmentally disabled in their facilities. It's used with people who have substance abuse problems, people who have chronic pain. There's so many different entities in which music therapy is beneficial.
So you've told us a little bit about what music therapy is. Can you touch just quickly on some of the things that are not music therapy interventions?
Music therapy is definitely clinically based, and there's research that provides evidence that the interventions are beneficial. But there are other ways in which you might see music used in facilities. For example, a person may come into a lobby of a hospital and play piano for people, or a choir might come in and perform on one of the units. Or you might see a person with Alzheimer's listening to their favorite music on an iPod. That, however, is not music therapy because those things are not based in clinical evidence. They're beneficial activities, but it's not music therapy. And again, music therapy is only done by a credentialed professional who has completed an approved music therapy program.
I wanted to pick up on the Alzheimer's comment. Can you tell us a little bit about how music therapy benefits an Alzheimer's patient?
Certainly. Music is based in rhythm, just like our human bodies are based in rhythm. And because of that common element, it provides a structure for people to respond to. Thus, when people have Alzheimer's or dementia-related disorders, there's a structure that they can respond to, and it creates some familiarity for them, there's predictability for them, and a sense of security that they don't otherwise have. So people who are in like the late stages of dementia, who seemingly have lost contact with the world around them and don't even recognize their spouse anymore, suddenly come to life, and they're in contact with the real world again as they work with music. And they start singing and dancing and talking. They recognize people again. It is an incredible moment.
That is so amazing. And for people, maybe older people who don't suffer from Alzheimer's but may benefit from music therapy, can you tell us how music therapy benefits that segment of the population?
Sure. Music therapy can help people who have psychological challenges, physical challenges, social challenges, even cognitive challenges. And again, sessions are formulated to assist people with specific problems. So as you work with those people, you can help them to decrease depression that they might be experiencing. You can help them increase social interactions, give them a sense of control over things in their life again as they experience success within that setting. And you'll see increases in self-esteem, an increase in self-confidence. People begin to interact more with the world around them. They become more aware of their own personal feelings, and they gain insight into issues that might have been troubling them.
So I want to go back even a little farther. Can you, obviously at Shodare you work with children. Can you tell us a little bit about how music therapy is integrated into kids' lives?
In music therapy, I help the kids learn coping skills that they can take with them when they leave the hospital. It might be making a CD cover to help them bring thoughts and feelings outside of them safely. It might be in helping them learn how to relax and alleviate some of the anxiety that's in their lives. I've also used music therapy in family therapy settings at Chaudere. And it is a tremendous help there when families seemingly get stymied because issues are difficult to talk about. And they suddenly are just stopped and they can't go forward anymore. So we bring some music into the session and do some nonverbal work where people are expressing themselves by using instruments. And before long, they start formulating words that they can use to describe what they're experiencing internally. And the family is able to start moving forward again. Music therapy can help to strengthen some of the bonds within the family and repair some of the bonds that have seemingly been stretched or broken or are in jeopardy in one way or another. So there's many, many different ways that music therapy can help children. And because it's a sensory input technique that's involved there, children can benefit on many different developmental levels because music works through both sides of the brain. So incredible things can happen as you work with music.
This has just been so incredible, Cheryl, and I just want to thank you for sharing all of your information, your talents with us. And I wish we had some music that we could demonstrate here, but I know that we're about out of time, so I just want to thank you again for being with us. And I also want you to stay tuned. We'll be back with more with our next guest right after the break.